Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart. And always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
a safe environment
and embrace a border reopening lifestyle.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. People from all walks of life must keep practicing social distancing. Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers and prevents the spread of disease. We all have an individual and collective responsibility to avoid large social gatherings. These types of gatherings are deemed as super spreader events. Taking disease prevention seriously will enable a worry-free return to normal life.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. Therefore, self-health management is an important step in this process. Self-health management refers to the measures people take to manage their own health. You and I should remember to wash hands often with soap and water, or use alcohol-based hand sanitizer. Avoid touching your eyes, mouth, and nose. Take your temperature morning and evening. Watch for symptoms. Persons with diabetes or hypertension are reminded to take your medication regularly as prescribed. If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear a mask at all times. If you develop symptoms, put on a mask and seek medical care. Do not take public transportation. Inform the doctor of your travel history, any contact with confirmed or suspected cases, your occupation, and whether anyone around you has similar symptoms. If you become ill, please rest at home. Wear a mask and isolate yourself from others in your household. If you share a bathroom, disinfect daily using 1 part bleach to 10 parts water. Everyone must work together to reduce the spread of the coronavirus when our border has been opened. Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart, and always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
A safe environment
And embrace
a border reopening lifestyle.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. People from all walks of life must keep practicing social distancing. Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers and prevents the spread of disease. We all have an individual and collective responsibility to avoid large social gatherings. These types of gatherings are deemed as super spreader events. Taking disease prevention seriously will enable a worry-free return to normal life.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. Therefore, self-health management is an important step in this process. Self-health management refers to the measures people take to manage their own health. You and I should remember to wash hands often with soap and water, or use alcohol-based hand sanitizer. Avoid touching your eyes, mouth, and nose. Take your temperature morning and evening. Watch for symptoms. Persons with diabetes or hypertension are reminded to take your medication regularly as prescribed. If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear a mask at all times. If you develop symptoms, put on a mask and seek medical care. Do not take public transportation. Inform the doctor of your travel history, any contact with confirmed or suspected cases, your occupation, and whether anyone around you has similar symptoms. If you become ill, please rest at home. Wear a mask and isolate yourself from others in your household. If you share a bathroom, disinfect daily using 1 part bleach to 10 parts water. Everyone must work together to reduce the spread of the coronavirus when our border has been opened. Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart, and always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
A safe environment
And embrace
a border reopening lifestyle.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. People from all walks of life must keep practicing social distancing. Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers and prevents the spread of disease. We all have an individual and collective responsibility to avoid large social gatherings. These types of gatherings are deemed as super spreader events. Taking disease prevention seriously will enable a worry-free return to normal life. Thanks to the
Leadership Matters, joining Prime Minister Dr. the Honorable Timothy Harris to continue the discussion about the October 31st reopening of the Federation's border crossings are Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, and the Chief Financial Officer and Officer in Charge of the St. Christopher and Nevis Air and Seaports Authority, Ms. Tafida Stewart. Tonight, Prime Minister Harris will make a definitive statement in relation to St. Kitts and Nevis's participation in the Caricom travel bubble. The SCASPA high-level representative will update the public on the retrofitting work being done at the Robert L. Bradshaw International Airport. The health experts will address entry and quarantine requirements, along with other protocols being implemented to minimize the risk of reintroducing the coronavirus into our society. Only 19 coronavirus cases have been confirmed in the Federation, and they have all resulted in full recoveries and therefore no deaths. There is much to discuss, so I now invite the Prime Minister of St. Kitts and Nevis to present his opening remarks.
Thank you, Valencia. My fellow citizens and residents, I want to begin by thanking you for tuning in on another occasion to Leadership Matters. This is a public accountability forum where high officials of my government lay themselves open to public input and conversation regarding the big issues of the day. Certainly, there is no bigger issue than the matter of the reopening of our borders, and tonight we want to continue that particular conversation. A bit of a backdrop is perhaps important in this regard. You will recall that on March the 11th, 2020, the Director General of the World Health Organization declared COVID-19 a pandemic, which meant that it had spread to every corner of the globe. St. Kitts and Nevis, despite being one of the smallest nations in the world, was among a few countries that were able to keep the virus at bay for an extended period. This was not by accident, but the result of proactive steps taken very early by your government to protect lives and livelihoods. We called for an all-of-society approach in fighting this pandemic, and we all pulled together as one over the last 7 months and successfully contained the virus here in St. Kitts and Nevis. I have said repeatedly that in a crisis, the safety and security of my people are my primary responsibility. Therefore, we acted quickly, decisively, and deliberately in putting measures in place to shield the people of St. Kitts and Nevis from the devastating effects of a most dangerous virus. Bold, courageous actions had to be taken to prevent the loss of lives in our beloved country. We would all remember the closing of our borders, the stay-at-home regulations, and lockdowns that were all imposed early in order to contain the virus. The livelihoods of over 5,000 persons dependent on tourism and hospitality were severely affected as hotels and restaurants closed. St. Kitts and Nevis is regarded as a success story that is admired by many, regionally and internationally. To our great credit at this time, we have 0 active cases, 0 hospitalizations, and 0 deaths from COVID-19. The Centers for Disease Control and Prevention recently assessed the Federation of St. Kitts and Nevis as very low risk in its recent travel advisory, which is one of the lowest risk categories for any country. I announced on October 1st that our borders would reopen on the 31st of October 2020, and so we did. Our Chief Immigration Officer has advised that the opening has proceeded apace and without major adverse developments. You would recall that in advance of the reopening of our borders, we had put in place protocols and procedures to keep our frontline workers and, by extension, our people safe. These protocols are very stringent, with the requirement of a pre-arrival PCR testing and a 14-day quarantine or vacation-in-place experience for 14 days for arriving international passengers. While we were working on our local entry requirements, we were in discussion with our regional Caribbean neighbors to see if there was a common platform that we could use to enhance travel in the Caribbean region by way of a Caricom travel bubble. The Caribbean Public Health Agency, CARPHA, working with Caricom countries, put together recommendations for a Caricom travel bubble. The regional travel bubble was intended to facilitate low-risk intra-regional travel of nationals of the Caribbean community, the movement of essential workers, and inter-regional travel of visitors to the region in an effort to revive tourism while respecting necessary health precautions. The bubble would have seen persons coming from qualifying Caricom countries forego the mandatory 14-day quarantine period once they had a negative PCR test within 72 hours of arrival within a member state participating in the bubble. The borders of St. Kitts and Nevis were still closed on Friday, September 18th, when the Caricom travel bubble came into effect. Accordingly, we could not participate in the initial launch of the bubble. We, however, indicated our support in principle for the concept. Since the announcement of the formation of the Caribbean bubble, we have seen a change in the risk level of a number of countries within the bubble, with Antigua and Barbuda, St. Lucia and Barbados experiencing a resurgence of new cases. We have taken note of reports about actual or potential community spread in some member states. We are concerned that the travel entry requirements are also not uniform, as requested by CARPHA, with a number of member countries having less stringent requirements than those we have put in place in St. Kitts and Nevis to keep the virus at bay. We cannot, therefore, as a nation, with a very low risk category assessment, enter a common space or bubble with countries at a higher risk level, because we would be exposing our people to elevated health risks. Similarly, it will be unwise, given our low-risk status, to participate in a bubble with others within the community, to participate in a bubble with others with community spread. If we were to do this, we will very quickly see the reintroduction of the virus and possibly the overwhelming of our healthcare system and consequential deaths. Having discussed this matter at length yesterday with the Cabinet and our National COVID-19 Task Force, and having arrived at a consensus, I have today advised the Secretary General of Caricom, Ambassador Owen Lorock, that St. Kitts and Nevis has in our national interest, albeit for health reasons, withdrawn from the bubble effective immediately. I repeat that St. Kitts and Nevis has, in our national interest, albeit for health reasons, withdrawn from the bubble effective immediately. I have also directed our Chief Medical Officer to advise CARPHA of this decision. The Federation of St. Kitts and Nevis now requires a mandatory 14-day quarantine for all travelers from Caricom countries, in addition to a negative PCR test 72 hours prior to arrival. The 14-day quarantine is an international best practice, taking into account the incubation period of the novel coronavirus. It is the best and safest standard, and clearly is in sync with our strategy to open up while keeping risks to our population at a very low level. In other words, entry requirements for Caricom nationals will be the same as those for international travelers. We will, however, continue to monitor the situation and look for ways in which we can work with our Caricom brothers and sisters going forward. This would require the establishment of common entry requirements for regional and international travelers, irrespective of countries of origin. The COVID-19 pandemic continues to wage a war against mankind, and we will continue to do all in our power to keep our country and our people safe. All arriving passengers into our country must therefore be prepared mentally and otherwise for quarantine. Some have asked whether minors and seniors will also be quarantined, and the answer is an emphatic yes. They will be quarantined as a necessary health precaution. Accordingly, we advised that any minor traveling to St. Kitts and Nevis must be accompanied by a responsible adult. Both the minor and adult will be subject to quarantine on arrival. In a similar way, persons with disabilities who will require special assistance and care should be accompanied by a responsible adult. Today, I participated in the second ACT Accelerator Facilitation Council meeting, which discussed how the global response to secure COVID-19 tools can be accelerated. I represented the Caricom region in my capacity as its lead head for health and related issues. There has been a significant mobilization of resources to defeat COVID-19 through equitable access to vaccine, therapeutics, diagnostics, and the strengthening of our health systems. I was heartened to learn that a portfolio of safe and efficacious vaccine can be available by March 2021, should the global community mobilize adequate resources to close the financing gap. We in St. Kitts and Nevis remain cautiously optimistic. St. Kitts and Nevis has taken proactive steps to pay in advance to secure our access to a reliable portfolio of vaccines as soon as they are available. The truth is, until we have an affordable, safe vaccine which gives prolonged immunity, the deep economic crisis caused by the pandemic will continue to scar lives, scar businesses, scar economies, and the global community. My government continues to engage all of society as we seek to chart an all-inclusive plan to restore our economy to the strong position it was before COVID-19, and thereafter to ensure that our economy is put in such good health that it can contribute to the stronger and safer future. Your government will remain focused and agile in the face of the vicissitudes of the COVID-19 pandemic. Your best interest is our primary concern. Working together, we can defeat COVID-19, and from this commitment, your government will not shirk. I thank you for paying attention to all the advisories and information with respect to COVID-19. And as we continue with our borders open to receive visitors, I trust that you will not let down your guard. May God continue to bless the people of St. Kitts and Nevis, and may He continue to keep this beautiful country safe and free. I thank you.
Giving that important presentation. I'd like to call on Dr. Cameron Wilkinson, who is the Medical Chief of Staff at the Joseph and France General Hospital. The audience would recall that Dr. Wilkinson, along with the Chief Medical Officer, both of them were named recipients of the Companion of the Star of Merit for long and meritorious service, or for loyal and devoted service to the nation, particularly during the coronavirus crisis. So we are honored to have both of them here with us tonight on Leadership Matters. I now turn to Dr. Cameron Wilkinson to present his opening remarks.
The Federation of St. Kitts and Nevis has been kept in a safe bubble, different to the Caribbean bubble to which the Prime Minister referred for some time. Over the last 7 months, while the rest of the world struggled to contain the deadly coronavirus, we were able to successfully emerge from the lockdowns and restrictions imposed earlier to a near normalcy internally. We saw churches, schools, and businesses open, and our people began to move around freely within the new norms. We safely repatriated many nationals, residents, and students from hotspots around the world without seeing a resurgence of the virus locally. The 19 imported cases we had have all recovered, and we are now one of the few nations around the globe with 0 active cases. We used a prescription of non-pharmaceutical measures, i.e. physical distancing, hand sanitizing, and wearing of masks, along with our robust testing, isolation, and quarantine measures to contain the virus. Our singular focus was lives over livelihood initially, and we saw great success in the fight against the virus compared to many great nations. As we emerged from the harsh restrictions in an effort to generate economic activity and get back to near normal, some began to experience COVID fatigue. People got tired of being cooped up, tired of being careful, tired of being scared, tired of wearing masks and social distancing, and wanted to get back to their normal life. It is this fatigue that made some people become careless and complacent, which is contributing to some of the spike in cases we are seeing around the world. I am happy, however, that with our all-of-society approach, we were able to get the majority of our people on board with a laser-eye focus on fighting this virus. The virus has not left us. As we see globally, there are over 46 million cases and over 1 million deaths to date. Just to the north of us, the United States is experiencing a resurgence of cases with about 9.2 million positive cases and over 231,000 deaths. Since the last October 29th CARICOM situation report, an additional 7,019 cases were confirmed in 27 countries within the Caribbean, bringing the region's total confirmed cases to 277,170. This total represents a 3% increase in the number of confirmed cases, which is significant, and a total of 4,564 deaths as of November 2nd. A number of countries within the bubble that the Prime Minister referred to are experiencing an increase in their cases with possible community spread. These are Barbados, Antigua, Dominica, St. Lucia, and St. Vincent and the Grenadines. The CARICOM agreement clearly recommended that countries should have no new cases or less than 20 cases per 100,000 in the last 14 days to be eligible to be in the bubble. It also gave member states the flexibility to reintroduce travel restrictions for a specific country if the criteria are no longer met. The agreement also gave member states the flexibility to refuse entry to the non-national traveler presenting a threat to public health or national security, even coming from a country from which the restrictions are lifted. Once we continue to have different entry requirements across Caricom countries, we will have different levels of risk and exposure to the virus. Our low-risk status that we currently hold will be jeopardized by any country with a less stringent protocol for entry than we do. The negative PCR test prior to arrival and a 14-day quarantine and vacation in place is what has kept us safe thus far and made us a preferred destination on the tourism map. Once we keep the health and safety of the nation as our primary focus, then every decision thereafter is made much easier. That is why, after re-evaluating the situation with regards to the increased spread of the virus in some of the countries in the regional Caribbean bubble, we came to the decision, in the best interest of the nation, to exit the bubble. All visitors to the Federation will therefore be considered high risk and subject to the same protocols for entry. We will continue to work with our Caricom neighbors to develop protocols uniform to all, so that we will all have the same level of protection of our borders from the virus and eventually move freely in a common space. Until such time, the task force is in full support of our removal from the regional Caribbean bubble. Lastly, as our borders are open now, we need to remember the essentials in fighting COVID-19. First, we need to prevent amplifying events by avoiding the 3 C's: crowds, closed spaces, and close contact. Second, we need to protect the vulnerable among us, the elderly and those with pre-existing conditions. Third, we need to continue to educate, empower, and enable communities to protect themselves and others using every tool at their disposal. And fourth, we need to continue to get the basics right, as we have done, to find, isolate, test, and care for cases, and trace and quarantine their contacts. Remember, until a vaccine becomes available, an essential tool in the fight against the virus is the face mask. Please wear it. I thank you.
Thank you very much, Dr. Cameron Wilkinson. I now turn to Chief Medical Officer Dr. Hazel Laws to present her opening remarks.
Thank you, Valencia, and a pleasant good evening to everyone. This evening, my opening remarks will focus on the health and travel protocols for the Federation of St. Kitts and Nevis. Just by way of background, I want to add that tourism is the main economic driver for the Federation. Our borders reopened last Saturday, October 31st, to international travelers and tourists. As a Federation, our aim is to reopen safely with minimum risk of reintroduction of the virus to the Federation. We have confirmed a robust set of protocols to ensure safety for our frontline workers and safety for our inbound travelers and tourists. Between Saturday and present, 40 inbound passengers, 40 outbound passengers, and a total of 29 chartered flights have been processed at our 2 airports, 38 in St. Kitts and 42 in Nevis. In essence, we've utilized the past 4 days to test the systems that we have in place. What are our health and travel protocols? All inbound passengers or travelers to the Federation will be classified as having significant or high risk of exposure to the virus. You may ask, what are the pre-arrival requirements for all travelers via air or sea? All inbound travelers to the Federation will be required to log on to the COVID-19 national website, www.knatravelform.kn, before traveling. The traveler is expected to complete and submit the customs border, and health entry form with required details, including evidence of a negative COVID-19 PCR test. This test must be done within 3 days of travel. For example, if you're traveling on Saturday, we advise that by Wednesday morning, you find an accredited lab, get your sample taken, and your test processed. The test must be done at an accredited laboratory in the traveler's host country. Now, travelers en route to St. Kitts include returning nationals, residents, work permit holders, tourists. What are the requirements for tourists and international travelers? Travelers in this category will be required to complete the entry form, as I mentioned. They are also required to submit a negative PCR COVID-19 result. The test should have been done within 3 days of travel. The inbound traveler must submit confirmation of hotel reservation at either of the following hotels: Park Hyatt, Four Seasons in Nevis, the St. Kitts Marriott Resort, or Marriott St. Kitts Vacation Beach Club, Royal St. Kitts Hotel, the Koi Resort, or Paradise Beach in Nevis. It's important each traveler must submit confirmation of hotel reservation in order for your form or for you to be given approval to come into our federation. The traveler will be required to undergo focused health screening at the airport and will be asked to download and install the St. Kitts and Nevis COVID-19 mobile app XMAP. If the tourist is asymptomatic, that is without symptoms, without COVID-like symptoms, he or she will be allowed to enter the federation. The inbound traveler or tourist will then be vacationing in place at their hotel with access to an approved package of services for the first 14 days or for the duration of stay if shorter. The international tourist will be required to do serial testing. That is, he or she will be tested on day 7 and on day 14 if still in the federation. If the test on day 7 is negative, the tourist can be allowed only through the hotel's concierge or tour desk and by appointment only. They will be allowed access to COVID-19 approved tourist attraction sites on the island in a secure bubble. All inbound travelers must receive a PCR test on day 14 of stay. And once the result is negative, the tourist will be allowed to integrate into the society. If vacation period is less than 14 days, the tourist may depart the federation having completed an exit COVID-19 PCR test which is negative. Please note, tourists and international travelers can only use COVID-19 certified ground transport with appropriate petitions to move between the airport and the hotel and the various tourist attraction sites. What are the requirements for returning nationals and residents or work permit holders? Travelers in this category must also undergo focused health screening at our airports. Nationals who are returning to the Federation and who are free of COVID-19 have the option to stay at the following accommodations. You can stay at the Oali Beach Resort Hotel in Nevis if you're a national. If you're a national, you can also stay at Potworks in Nevis and Paradise Beach. If you are returning national, you can stay at the Ocean Terrace Inn in St. Kitts. You can also stay at the Royal St. Kitts Hotel in St. Kitts. Returning nationals can also opt to stay at any of the 4 franchise hotels, namely the Four Seasons Resort in Nevis, the St. Kitts Marriott Resort Hotel, and Marriott St. Kitts Vacation Beach Club, Park Hyatt, and the Koi Resort in St. Kitts. Nationals and residents may also opt for pre-approved quarantine and pay for security facility. Interested returning nationals or residents may access the pre-approved option by visiting the following website: www.covid19.gov.kn, www.covid19.gov.kn. Returning nationals will not be allowed the self-quarantine option in their homes unless they employ at their expense the services of private security. In other words, we are not allowing individuals to quarantine at home without security, without the security facility. What are the requirements for in-transit passengers at either of our two airports? In-transit passengers are also expected to show their COVID-19 PCR test result. They are expected to wear a face mask while at our airports. In-transit passengers must also undergo focused health screen at our airports. In-transit passengers will not be permitted to leave the airport after clearance by immigration, customs, and port health officials. You may ask, what happens to an inbound passenger who exhibits symptoms or COVID-like symptoms? Such an individual would be channeled to the testing booth in the isolation unit at either of the airports, where a nasopharyngeal swab will be extracted and sent to the local lab for processing. The symptomatic traveler will then be evaluated, triaged in the isolation unit, and await transfer. Who will be tested upon arrival? All travelers are required to present a negative PCR test to enter the Federation. Such tests, as we've said before, must be done within 72 hours of travel. The test must be done at a reputable, accredited lab. In other words, we are trying to prevent the submission of fake or fraudulent PCR test results. If the health authorities have reasons to suspect that the laboratory is questionable or the test is outdated, fabricated, or inadequate, you will be required to be tested upon arrival. Inbound travelers who are exhibiting COVID-19 symptoms will also be tested upon arrival. Diplomats and inbound travelers with special needs. Specific travelers with non-standard circumstances to be addressed are advised to contact the St. Kitts Nevis COVID-19 Task Force via email. In other words, send an email to COVID-19 Task Force at gov.kn at least 5 days prior to travel to the Federation, so as to have your requests considered for approval. Specific travelers include diplomats, persons with medical conditions warranting special considerations, and persons with a disability or traveling with persons with disabilities. Flight crew. Flight crew are required to submit their crew COVID-19 status card as prescribed by the International Civil Aviation Organization and undergo focused health screening, including temperature check at the health screening unit at the airports. Flight crew must wear face masks while in the Federation. Flight crew who are involved in flights with layover can only stay at one of the following accommodations: Royal St. Kitts Hotel, Park Hyatt, St. Kitts Marriott Resort, Marriott St. Kitts Vacation Beach Club, Four Seasons, or the Koi Resort. Flight crew who are part of layover flights can only stay in place at the above stated accommodations. They can only access services on the hotel property and can only leave the hotel en route to the airports for departure from the Federation. What are the requirements if an inbound traveler enters the Federation via our seaports? Inbound travelers entering the Federation via sea vessel will also be required to complete the entry form. The vessel will be required to dock at one of the following 6 ports. Submit the Maritime Declaration of Health to the Port Health Officer and interact with the other border agencies. The 6 ports of entry include the Deepwater Port, Port Zante, Christophe Harbour, New Guinea, Charlestown Pier, Long Point Pier. Inbound travelers who arrive via sea vessel will be processed accordingly and will vacation in place or quarantine in place as outlined already. The prescribed quarantine time will be determined by the vessel's or the ship's transit time between the last port of call and date of arrival into the Federation. The transit time must be supported by official documentation and the Sail Clear advance notification system. Yachts and pleasure vessels that are over 60 feet must quarantine at Christophe Harbour in St. Kitts. Yachts and pleasure vessels that are less than 60 feet must quarantine at the following sites: Ballast Bay in St. Kitts, Pinnis Beach, and Gallows in Nevis. There is a fee that will be charged to monitor yachts and pleasure vessels that are less than 60 feet that are in quarantine. If you are applying or submitting an entry form to enter St. Kitts and Nevis, how would you ascertain approval? Inbound travelers will only be granted permission to enter the Federation if the following criteria are met. The traveler must submit a negative COVID-19 PCR test result. The traveler must submit reservation for appropriate accommodation as per the protocols. The traveler must also submit consent forms and the end user licensing agreement for the St. Kitts and Nevis COVID-19 mobile app. Ladies and gentlemen, we are doing our part to reopen our borders safely. However, each of us have a role to play in preventing the transmission of the virus and keeping our island safe. We have a responsibility to prevent the spread of the virus by adhering to the prevention and control measures that we've been explaining over the past 7 months. Let us continue to follow the science, work together to fight the COVID-19 pandemic, and rebuild our economy. Thank you.
Thank you very much, Dr. Laws, for such a detailed presentation. I now turn to Chief Financial Officer and Officer in charge of the St. Christopher Air and Seaports Authority, Ms. Tafida Stewart, to present her opening remarks.
Thank you, Valencia. A pleasant good evening to all. The government of St. Kitts and Nevis has done a commendable job in managing the COVID-19 pandemic. With only 19 cases, all recovered, the Federation is viewed as an attractive destination for visitors. The CMO stated in the last NEOC press briefing that the borders are open and COVID is coming. The St. Christopher Air and Seaports Authority, SCASPA, being the airport and seaports operator, is cognizant of the fact that there is an uptick in the COVID-19 cases within our Caribbean bubble and the number of COVID-19 cases in our tourism source markets, such as the USA, UK, and Canada, is growing. Given this, and with the support of the central government and input from the NEOC and the CMO, the airport's facilities have been retrofitted and protocols augmented to ensure the safe processing of passengers while protecting the airport employees. Our borders have opened to commercial activities on October 31st, 2020. And this came with noted changes to airport access and airport operating protocols, all with your safety in mind. First, I will address airport access. Access to the RLB airport has been restricted to those persons with reason to conduct business at the airport. For example, airport employees such as government agencies, airline agents and handlers, concessionaires, cargo customers, brokers, and persons departing the Federation. On entrance to the airport, SCASPA security would inquire about the nature of your business. Documented proof must be provided before access is allowed. For example, if you're an employee, your SCASPA ID needs to be presented. If you're traveling, your travel documents, or if you're there to clear cargo, your cargo clearance documents. Mask must be worn to be allowed entrance, except for children under 6 and persons with a medical certificate of exemption. Temperature would be checked on entrance. Only persons with a temperature of under 100.4 Fahrenheit would be allowed entrance into the airport's compound. Taxis and tow operators would be allowed at the airport in limited quantities as per dispatch schedules. Transportation which does not have the travel approved seal will be denied access. Private vehicles dropping off passengers would be allowed to enter the parking lot to drop off in the designated areas. To be allowed access, the traveling passenger must produce proof of travel. Also, in addition to the driver, one other person is allowed in the vehicle to assist with the removal of cargo or luggage or provide assistance to persons with disabilities. Red cab services would be available to departing passengers only. Children would not be allowed access to the airport unless they are traveling. Secondly, I'm going to examine the parking at the RLB airport. SCASPA has placed the airport users into 2 risk categories. Low-risk users, which includes departing passengers and or local users of the airport facilities, and high-risk users, which are the arriving passengers. These risk categories were used to guide the operating protocols to, as far as possible, reduce or eliminate the commingling of arriving and departing passengers. To achieve this, the main parking lot is used exclusively for parking of low-risk users, that is, the airport employees and the drop-off of departing passengers. The drop-off of passengers must be done in the designated areas within the parking lot. Parking is not allowed. Security patrol would be in full effect, and persons found parking would be ticketed. The parking lot that housed the COVID-19 approved transport for the high-risk users, that is, arriving passengers, are adjacent to the customs baggage hall. They are the tow operator's parking lot, and what was once the VIP parking lot is now the taxi waiting area. The main taxi stand remains operational as a holding area for approved taxis on the dispatch schedule. Arriving passengers would not have access to the main parking lot. The SKTA would manage the dispatching process of arriving passengers and direct them to the assigned approved taxi or tow operator. Thirdly, passengers movements outside of the airport terminal. To reduce commingling of the high-risk and low-risk users, i.e. arriving and departing passengers, the drive-through under the canopy has been blocked off from vehicular traffic. This section is reserved for passengers queuing both at arrivals and departures. However, there is a barrier under the canopy that physically separates the arriving from the departing passengers. Again, all in an attempt to limit the risk of the spread of the virus. Lastly, but by no means least, the passenger process through the airport. The departing passenger process remains the same, except that the passenger would need to present their passport and travel documents to be allowed entrance into the check-in area. The CMO would have addressed the requirements for entry into the Federation, as although the borders are closed, measures have been implemented to minimize the risk of the spread of the virus. On arrival, passengers must undergo medical screening. SCASPA has, over the last month, retrofitted the facilities to accommodate this. The retrofit work that was recently completed by SCASPA was very extensive. It included the construction of a welcome center, which is a holding area that allows the passengers the opportunity to regulate their body temperature ahead of medical screening, a pre-screening queuing area, medical screening room, an isolation center, and an enhanced customs baggage area, all geared towards the safe processing of arriving passengers. Throughout the airport, SCASPA has physical distance markers on seating and on the floors, hand sanitizing stations, additional signage to guide the passenger movements, sneeze guards on all counters, and of course, the airport staff are equipped with the required PPEs. We understand that COVID-19 is unprecedented, and we are operating in a fluid environment. Therefore, the measures that I just outlined are all subject to change as the national COVID-19 protocols change. Thank you.
Thank you very much, Mr. Feeder Stewart, for that information. On a related note, some time ago, I read a release from the St. Kitts Tourism Authority. The St. Kitts Tourism Authority released a notice today. You'll be seeing it in the media in the coming days, but I just want to update you. The notice says, "Dear tourism stakeholders, please note the following airline schedule for American Airlines, British Airways, and Win Air for November 2020 only." So British Airways, it seems, has been cancelled coming out of the new national lockdown in England in place from Thursday, November 5th through Wednesday, December 2nd. So the British Airways flight to RLB out of London Gatwick has been cancelled in the meantime. So the notice just alerts the public that British Airways for November has been cancelled. There's service between St. Martin's Princess Juliana International Airport and RLB International Airport. This release says today, earlier today. And of course, American Airlines is still in play from Miami to St. Kitts and Nevis. The schedules are from Saturday, November 7th through November 29th. Okay, so when we come back from a short break, it will be your turn to speak to us. The numbers are on the screen, but for the benefit of the radio listeners, I'll give the call-in numbers. They are 869-466-2666, 662-8674, 767-4765, and our overseas line is 239-645-4500. Questions can also be sent via WhatsApp to 869-661-5683. However, first preference will be given to those who phone into the program. We'll come back after a quick break.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart. And always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
a safe environment
and embrace
a border reopening lifestyle.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. People from all walks of life must keep practicing social distancing. Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers and prevents the spread of disease. We all have an individual and collective responsibility to avoid large social gatherings. These types of gatherings are deemed as super spreader events. Taking disease prevention seriously will enable a worry-free return to normal life.
Welcome back to Leadership Matters. We have about 4 callers on hold, so we'll go straight to the phone lines. But first, for those of you who may have missed a very important announcement from the Prime Minister of St. Kitts and Nevis, he said St. Kitts and Nevis has in our national interest, albeit for health reasons, withdrawn from the Caricom travel bubble effective immediately. Good night, caller. You're live on Leadership Matters.
Hello.
Hi, good night. We can hear you.
Good night, Leadership Matters. Good night to the Honorable Prime Minister. This is Bucky Garrett. First, let me say thank you for having this program tonight. Tonight is a very busy night. We know we have the election in the U.S., but leadership really matters. You are the leader of the country, and we have to take care of our own self. I'm happy that you have taken our country out of the bubble because you continue to show leadership and keep us safe. Yes, in spite people want to travel, but health is important, and you have taken it as number one priority in keeping us safe thus far during the COVID-19. My question really, I don't know if maybe yourself would answer it or the panelists there. in terms of passengers coming in, right? We have seen 2 incidents happen where guests and our visitors get into some kind of altercation, right? My thing is that how are we able to deal with a guest who refuses to put on a mask during a tour, going to the hotel, right? I know you have a fine in place, but will that fine be paid before that guest leave? These are some of the questions that some of the taxi guys are wondering. I'm not saying it will happen, but as the borders are now open, we are preparing ourselves for anything. We know these are tough times. Persons are very frustrated. They're traveling, there are different kind of screening they have to go to. So we're wondering, if there's anything in place to deal with such passengers that may have these problems. On the whole, Mr. Prime Minister, continue doing a good job. I mean, decisions are very important, and you will continue to make the right decisions for thinking. So I want to point us that, and thank you again for coming on tonight, especially during this busy time. I'll continue to listen after you.
Thank you very much, caller. Good night, caller. Good night. You're live on Leadership Matters. Do we still have those callers? Good night. You're live on Leadership Matters.
Good evening, Ms. Moderator.
Good evening.
Thank you for taking my call. And good evening, Mr. Prime Minister and the head table.
Good evening.
Yeah, now, Mr. Prime Minister, I have to commend you for taking the ship of state through these rough medical waters called Mr. Corona pandemic. And for that, you are showing what a good leader is all about. And we thank you very much because you are highly recognized internationally, globally, worldwide. So you are doing a great job. And like the old people say, when they taste your food, they say, keep your hands up. My question is now, we are properly secure and prepared internally for the incoming passengers. Now, how safe and secure we are with our sea, shore, bay waters. We have a few piers, legal place of entry, but what about those illegal places of entry? Like we know a lot of bay where people smuggle in and things. So my question is how secure we are with the national safety vessels in the waters. That's my question for tonight. Thank you very much for listening and taking my call.
Thank you. You're quite welcome. Good night, caller. You're live on Leadership Matters.
Hi, good night.
Good night.
Hi, good night. Valencia, I just want to commend you, and you are doing a wonderful job hosting the show. Hello?
Yes, go ahead, please.
Yes, I just want to tell you that you're doing a wonderful job hosting the show. And I just want to commend Honorable Lindsey Grant to coming back in the constituency, listening to the people in the constituency. I just want to commend him for that. And I just want to commend the Prime Minister and the decision that he has took for this bubble, the Caribbean bubble. I really commend him for that. And I just want to tell the Prime Minister, this is Yannick here. I just want to tell you that I just want to commend you on the road project, what's going around in the country. I was driving my uncle's old car. It's a very old car. And when I drive on the road, the New Brand road, it's like a new car I was in. I just really want to commend you and the great work that you are doing for this country. It is amazing. And you are doing well because performance matters. Okay? So, and you have a wonderful night, Prime Minister, and you get home safe. And God bless you, okay? And your government. I thank you.
Thank you, Yannick. Good night, caller. You're live on Leadership Matters.
Good night, Mr. Prime Minister. And everybody else should hear good night.
Good night.
The serious thing I have to tell the Prime Minister. Yesterday morning, about here, 11 o'clock, lying down listening Frank and Candy. And they had about three
different people calling, talking about the price control. I know that is not your job. Your job is to do the Prime Minister job. We got people got other jobs and who you employ to do their work. So I can't understand what's really going on, because this is an everyday thing. The kind of crisis where the world going through now, and because we are part of the world. I don't understand that sometimes you go to the supermarket today, buy something for a quart, and tomorrow it's for 50 cents. I don't understand it. And it's a complaint, and he's got into most of the supermarket. Right? I know a lot of people around me who just go to supermarket and shop. But I put me in mind the old time days when my mother and father used to work in the sugar. When they call the union for a grievance in the sugar cane. The people who come to represent go into the place of the white man office and take whatever drink they get, they come out and tell the people go back, go work. He put me in mind of that. Price control supposed to be doing the work. Somebody supposed to stand up for the poor people. We is poor people. The majority is thinking it is poor people. Whether rich man go or poor man go into a supermarket and buy. If we buy 2 cases of drink, I supposed to go buy 1. I can't afford him. I got to go to my pocket. So I can't understand. So Prime Minister, I want you to ask the people who you put at price control. Please talk to them, because they don't get a drink from the supermarket too. I ain't know, but I just asking, and I just putting it to you. They must have to look for the people who doing the shopping every day. Poor people go to shop, and not sometimes the local, them selling on the road, no price control at all. Nobody could tell me they got price control. Maybe somebody can pay for the job, but somebody is not doing it. So, Prime Minister, good night, have a good night, you hear? And tell the people them playing when Mr. Paul say. Okay.
Thank you.
Thank you very much, caller. Good night, caller. You're live on Leadership Matters. Do we have any more callers?
Yes, can you hear me?
Yes, but you need to step away. Sorry. Yes, there's feedback, so you need to.
Oh, you have enough feedback. Sorry.
Yes, ma'am, you need to step away from your computer or radio. Just turn it off and just speak straight into the phone, please.
Yes. You still have enough feedback?
Yes.
Hello, good night.
Good night.
Okay, I'm calling to ask a question. I'm moving away. I am a kitchen, but I want to ask a question because I need to come home. So, if I'm coming home, are you saying that I have to book a hotel, or the government have a place? And how much you have to pay? Hello?
We're listening to you. Oh, hello? Yes, we can hear you. Okay, so we will give you an answer. Definitely. Thank you.
Yes.
Is there anything else you'd like to add? Okay. Do we have one last caller? I see the phone line flashing. Good night, caller. You're live on Leadership Matters.
Good night.
Good night.
I have a few questions. Was SKN ever a part of the Caricom travel bubble? That's 1. Was it ever in effect? 2. And what date was the agreement cancelled? That's 3. My other question would be, please explain to me how someone coming from a place where the borders are closed or have been closed, and there have not been any active cases from probably April, and they're entering our islands and have to undergo a 14-day quarantine, even though, as stated in the Caricom bubble, which I think was mentioned on your program some time ago, that all the person required was a negative PCR test. And upon arriving at the airport, they would need to do checks and to upload the app. How can they jeopardize the community I agree that we want to protect our borders. But my point that I'm trying to make is that if it is the Caricom travel bubble was not properly planned, why did it come to the general public in the first place? My other question is, why is it that someone coming from a low-risk country where there's no record of cases where there are no record of cases, and they are being quarantined on a compound as persons coming from high-risk areas? My final question I would ask is, why is the length of quarantine the same for someone coming from a low-risk country with a negative PCR test, the same as someone coming from a high-risk jurisdiction? Thank you very much for your time. I listen off air.
Thank you for calling. I think we have one additional call. Good night, caller. You're live on Leadership Matters. Good night.
Yes, good night, to the panelists. I want to say, the lady from the port, Tafida, a question. Now, Tafida, I hear you speak about red caps. Now, what decision to decide that red caps cannot work on the right section of customs? Did you have a meeting in red caps? And decided that red caps cannot allow in customs to assist anybody with the luggage. I would just like to come into that clarification, because I heard you said red caps cannot allow to be in customs on the arrival side, but they can be on the departure side. Can you make some clarity why you decided, and did you have a meeting with the red caps for that decision to take place, or you just do it on your own? Have a great day.
Thank you. We've had a number of questions, but I still see we have one final caller for no. Good night, caller. You're live on Leadership Matters.
Good evening. Good evening.
Good evening.
Okay. Good evening, Prime Minister, Honorable Prime Minister. This is Bill Scarlett calling.
To you.
Good evening to you, Ms. Grant, and also to Dr. Laws, Chief Medical Officer, and also Dr. Wilkerson. Just today, I was talking to one of my care partners, and I told them that we had opened up our waters, and the concern, because I keep in tune with what is going on and with the bubbles, and I've seen how some of the islands have increased, how it spiked up, and that was my concern. And that I am praying to God that He would grant you all godly wisdom. And we had a great discussion upon, godly wisdom, how we seek the Lord's faith in what we are doing. And I thank God for you, Dr. Harris. I thank God for you, Dr. Laws, and Dr. Wilkerson, and the team, because you are a team that working together, not for your good alone, but for the good of every citizen, whether they're resident, living there, or even those of us who are abroad. And so I just want to commend you, give you thanks, and we will continue to hold you up in prayer. I'll call her tomorrow again and let her know what is happening, and we'll continue to hold you up in prayer, asking God to guide you. And I ask the people of St. Kitts and Nevis to realize what a blessing you are to us there, to us abroad, because you are protecting all of us. And you are not doing it on your own strength. You are doing it because the wisdom of God. And keep on doing all the good work. And for those of you who appreciate it, say to God be the glory, great things He has done. And in everything we give God thanks. because this every day is a day of thanksgiving for us, for you and the cabinet, and also the working team. Mr. Samuel, the NMA, and all those who have come together, the police, the nurses, the doctors, and all those who have been compliant to the protocols. God bless you all, and have a good night.
Thank you very much. Okay, we'll put a hold on the phone calls because there are a number of matters to be addressed. First, I will give the Chief Medical Officer and the Medical Chief of Staff at JNF General Hospital an opportunity to address those questions in relation to the Caricom travel bubble and any other related questions. I think that they were mainly on the Caricom travel bubble and the decision made today. Then I will turn to Ms. Tafida Stewart, a high-level representative of SCASPA, to address the question that was sent to her, directed to her. And lastly, I will turn to the Honorable Prime Minister for him to give his input on questions that were directed at him. Chief Medical Officer? Oh, sorry. Oh, okay, so Medical Chief of Staff. Yes, sir.
Okay, so in relation to the Caricom bubble, I think the Prime Minister made it quite clear that this was an agreement in principle. The bubble was officially formed on the 15th of September this year. And at the time when the agreement was made, St. Kitts and Nevis was still had their borders closed, and so we could not officially be a part of the bubble. We used the time while we were preparing for our opening to observe what was happening to other Caribbean countries that were in the bubble. And we have said before that with this virus, nothing is written in stone. We have to be able to follow the science and exhibit great flexibility in the decisions that we made. And so although there was an agreement that was made in principle to participate in the bubble, because initially all of the countries within the bubble were assessed as having low risk, over the following 14 days, we saw that there was a resurgence of the virus in some of these Caribbean countries, namely Barbados, Dominica, St. Lucia, St. Vincent and the Grenadines. And the agreement that was made with the Caricom member states gave countries the option to opt out if things increased. And so St. Kitts and Nevis, as a sovereign country, looking at the state of the virus that was multiplied in these other countries, made a decision in the interest of the health and welfare of our persons here to opt out of the bubble. And I think that this is a decision that almost every single Kittitian would be happy that we made, because we need to make sure that we do not overwhelm our healthcare system. And as long as each Caribbean country have different protocols for entry, and the thing that has kept us safe in the absence of a vaccine is the stringent entry protocols that we've had. And despite the fact that someone was speaking about why one has to go into quarantine even if they're coming from a country that has no active cases at this point in time. Every country was at a point when they had no active cases at a point in time. And unless we have the same entry requirements, we would have different levels of risk, and we cannot afford to expose our population to persons coming from these other countries. And so the protocol that we have now, every person coming to St. Kitts is considered high risk, whether you be man, woman, or child. And that is what has kept us safe, and those are the protocols that we'll continue to use until we get a vaccine or until the science tells us differently.
Thank you very much, Dr. Wilkinson. Dr. Hazel Laws.
Okay, so one of the callers would have asked about a guest refusing to put on a face mask and what are some of the consequences. And so at present we have the emergency powers regulations that's in vogue, and it says that such an individual can be fined not exceeding $5,000 or imprisonment not exceeding 6 months. And so if you have a guest on a hotel property and there's a challenge in terms of wearing the face mask, there are consequences based on the present emergency powers regulations, and this also will be reflected in the COVID-19 bill that will be eventually passed. Now, the other caller referred to illegal places of entry, and I'm thinking that's with respect to our seaports. At present, our Coast Guard helps to patrol and provide oversight of our seaports. However, I want us all to note that each member of the population, each member of the society has a responsibility to help us to monitor our ports of entry and our borders. And so if you see a suspicious looking vessel at an illegal port, it's your responsibility to call the police or the authorities and bring it to their attention, because we recognize that there are some of our Caricom member states who are experiencing surging cases and as a result of entry of illegal immigrants. And so we need to monitor our borders, and we all as individuals have a responsibility in so doing. The other caller asked about nationals. So if you're a national and you want to return home, what are your options? Well, if you are from Nevis and you want to stay in Nevis, you can stay at the Oali Beach Hotel, or you can stay at Potworks. If you choose Potworks, the cost is $400 US for the 14-day period, and then there's the additional cost of $100 US for the COVID-19 PCR test. Or you can stay at the Oali Beach. If you opt for the Oali Beach, you will have to call the front desk, make a reservation, and then you would negotiate the cost for that accommodation. If you are going to be staying in St. Kitts as a national, you can opt to stay at the Ocean Terrace Inn. It's not functioning as a hotel, however, there are rooms available, and the rate is $500 US for the duration of the 14 days, along with the $100 US for the test. You can also opt to stay at the Royal St. Kitts Hotel. However, you will have to call the front desk, make your reservation, and negotiate your room rate. As a national, you can also opt for pre-approved quarantine. So your house can be, or your villa can be evaluated, checked, and once it meets the requirement, and once you've consented to pay for the security facility, you can stay at home in that pre-approved quarantine site with the security facility. So at present, persons are not allowed to quarantine at home without the security facility. And this is important because just about a week and a half ago, we had a returning passenger who went into pre-approved quarantine, signed up for the security. However, he escaped, even with the security. And so therein lies the challenge. Period of quarantine of 14 days. Now this is the 14-day quarantine period is really the gold standard. It's the best practice. It's actually the incubation period for the coronavirus disease. And so if you are coming from a hotspot, New York, United Kingdom, if you are coming from one of the Caribbean neighbors where the incidence isn't that high at this time, the incubation period of the disease is the same. And so the quarantine period is 14 days. Please note that if you are coming from one of the hotspots, say New York, and your pre-arrival test is negative, that doesn't mean you do not have the disease. When you undergo serial testing and you're retested, say at day 5, day 7, or day 14, there is a chance that your test can return positive. And therein lies the reason for the 14-day quarantine period. Thank you.
Thank you very much, Chief Medical Officer. I'll turn to the Chief Financial Officer and Officer in Charge at SCASPA, Ms. Stewart, to weigh in on the question or answer the question that was asked of her.
Okay, the caller inquired as to why the red caps are allowed to handle the luggage of the departing passengers, but not the luggage of the arriving passengers. And it really comes back to risk. The arriving passengers are high risk, and allowing the red cap to handle their baggage exposes the red cap officers to the risk of contacting COVID-19 and in turn passing it on to your family members and to the community. So in consultation with the NEOC, the determination was made that it is best in the first instance for the red caps to be allowed to handle departing passengers only, given the risk on that side is very low, and to leave out the arriving passengers in the time being until we can arrive at a solution that would limit the risk of the red caps contacting COVID-19. So that is the reasons for that decision.
Thank you very much. I'll turn to the Honorable Prime Minister to give his input on a number of matters that were raised.
Thank you very much. Very quickly, I want to commend the callers for posing some very interesting questions at this time. I want to start with Yannick, who called and commended the government for the work that it has done with respect to the road. The build-out of public infrastructure will be a significant matter for which the Team Unity administration would long be remembered. We have launched the most significant capital project ever in the history of the country, and the road build-out has been one of them. The entire Island Main Road is being resurfaced. The last time that was done was in the period 93, about 94. So we have come full circle. 27 years after, it has taken a Team Unity government to enhance the quality of public infrastructure and in particular the quality of our roads. No wonder Yannick experienced the feeling he had in moving around in an old car. It was as if he was in a new one. And I hope that that continues to be the experience of all. But beyond the entire Island Main Road, which is now being completed, is that we also invested significantly large sums of monies to improve the infrastructure in a number of housing projects which had no roads, which had limited infrastructure. That cost us, of course, millions of dollars. And come to mind very quickly will be Mulfield in the Molyneux-Phillips area, where we expended significant sums. The roads at Boreas, Tabernacle, and we could go on and on, in Sandy Point, in St. Christopher, all over, Taylors, etc. The government invested quite a huge sum of monies to put things right in those communities and to enhance the quality of life in those particular communities. The matter of the price control and the efficiency of the price control unit is one which I shall engage the Minister Wendy Phipps on, since this matter has come up before. What we do know, when we look at some of the information or the data provided by the central bank, we are advised that inflation is down. That means we'll have to look again at the basket to see if the basket that has been examined by the official sources clearly reflect the new standards or the set of items which people would use regularly. And so to get a clearer understanding why and if there is a disjointedness in terms of experiences and report. But we want to have things to be affordable, the poor in particular to be able to access critical items for their daily living and to do so in an affordable basis. And so we will give that attention. That matters some attention, John Paul. I want to thank you for raising it. With respect to the bubble, I just want to add that the bubble presupposes that there are conditions, there is an established criteria by which member states, or any country for that matter, could become a part. And equally, there must be conditions by which countries could be asked to leave or voluntary to exit a bubble. So once the conditions are clear, for example, if you establish as a condition that within the last 14 days you must have no more than 20 cases per 100,000 in a population and you are at 25, then you would have to exit either voluntarily or by the recommendation of some authority. So bubbles by their nature, you are free to enter if you meet the criteria, and equally you are to exit once you do not meet the criteria. So that is where this situation is. In relation to the question, had the bubble been put into operation? Yes, the bubble had been put in operation. However, because there were limited flights, and there still are, we had not seen basically a significant impact of the bubble at this particular moment in time. But the bubble was officially launched, and there had been movement into member states on account of the new arrangements for the bubble. The Nurse Garnett called, and I want to thank her for calling all the way from Florida at a time when Florida is high in the news, having regard to the critical role I gather it will play in determining the outcome in the presidential elections. It shows the high level of ongoing interest she continues to maintain in our federation. Of course, she is an esteemed, long-serving health practitioner, and we commend her service to the people of St. Kitts and Nevis. I want to thank her for the commendations and for continuing to hold our federation, our government, our people in prayer. For me, it's a singular honor as a poor man coming out of the backlands of Tabernacle to have had the opportunity, thanks to God and the people of St. Kitts and Nevis, to serve this federation that I love for a second occasion as the Prime Minister. And I shall do my endeavor best to serve the people of St. Kitts and Nevis, giving it all that I got for such a time like this. It really has been an opportunity, a challenge, but an awesome experience to provide leadership at a moment of crisis. And it is a crisis that is new to almost all of us alive. This has been the most significant crisis to have impacted the world internationally at such, at least in the last 100 years or so. Certainly, the financial crisis has not had the same impact or the far-reaching impact as this pandemic, and there's no template for dealing with this crisis. So we are learning as we go along, and I want to thank the team, not only the medical team, but the entire National Task Force for COVID-19 for the tremendous commitment they have brought to national service, and indeed for the yeoman service they have given to our country at this moment of the world's greatest challenge. I think those were the issues that have come, and I have attempted to address those matters.
Thank you very much, Honorable Prime Minister. We will take a quick break. When we come back, we'll squeeze in about 2 brief questions. It's 15 minutes before the hour of 10. And we will also address a number of questions that came in online and WhatsApp before wrapping up. Thanks again for joining us for Leadership Matters. We'll take a quick break and come back.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart, and always wear your mask.
Always keep your hands clean. Wash your hands with soap and water, or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
a safe environment
and embrace
a border reopening lifestyle.
Welcome back to Leadership Matters. We will take 2 final calls. Do we have any callers on hold? Yes, we do. Welcome, caller. You're live on Leadership Matters. Good night.
To the Prime Minister, the Honorable Timothy Harris, good night to the medical team, and good night to Miss Grant and Nancy Grant. I would like to thank the government for what they are doing. They have been doing a wonderful job. And the medical team has been remarkable. They're second to none in the Caribbean. I've never heard of such medical terms of preparation for this coronavirus. Our protectionary measures are being put in place. Everybody talking about it. And I want to thank the government for what they are doing. This is a pandemic that everybody is frightened about and being scared. The borders are open, everybody anxious. I myself are feeling anxious and hoping that everything would go well. The government have been doing good. I also want to thank the Prime Minister for the promises he made and promises kept. The auxiliary workers would be pensionable. They would be going home with a little pension, a little something. We do the work. We does the work. But we go home with nothing. And I want to thank him. Dr. Douglas promised us, and he leave us hanging with nothing. And he promised us in the election campaign, and he make it possible. Promise made, promise kept.
God bless him. And I pray that the Lord will continue to bless you, keep you going, and look down upon you and this country. Bless the medical team again, and bless the government ministers and your colleagues as they continue to work for this country and make us happy. Have a good night and safe journey home, both of everybody there tonight. Good night.
Good night. God bless you too. Good night, caller. You're live on Leadership Matters.
Good night, Ms. Grant.
Good night.
And good night to the Honorable Prime Minister and his team, especially the medical team there, and the watch of the COVID-19. Now, Mr. Prime Minister, I want to commend you and the Cabinet and the COVID-19 task force. I believe from the time the corona outbreak, you and your team come together and put things together to control this thing in the Federation. I believe that you all have done a wonderful job. And you all can say more and what you could say. And I hope the people of this country listening to this daily briefing and look at the outer world, because everybody got internet, everybody got smartphone, and they see what's going on out there in the outer world with the corona when they don't wear the mask and they want to go to the protocol and do things the way. I just hope the people follow the protocol, because it's important, because we live in a little federation. And just imagine that if our people turn loose and try to do things what they ain't supposed to do, and some of our people get affected by carelessness. You understand? What become a thing that need this? So I want to commend you again and the team, your cabinet. I believe you are doing a wonderful job. No more in the necessary and the negative thing them out there. This country is us, and we got to look up for our country. And I believe that you, as a Prime Minister, to listen to the ordinary man and woman in the Federation, and you continue to listen. I know that everything you do in cabinet, you already got a decision to make, and you all don't agree with everything. But I just want to commend you again, and the cabinet, and the COVID-19 task force to doing a wonderful job from since this corona start. You all have a wonderful night. God bless. And God bless the Federation of St. Kitts.
God bless you too. I was doing a side glance to see if we have additional callers. I know I said 2, but I could squeeze in one last caller. Do we have an additional caller? No, we don't. Okay, that's fine. Okay, so I will turn to the online and WhatsApp questions. I will give the medical chief of staff at JNF General Hospital an opportunity to address one of the questions before turning to the chief medical officer, Dr. Hazel Laws. Dr. Wilkinson?
Yes.
Yes, there's a question. Oh, sorry, I thought you had it in front of you. What is the present procedure for human remains to enter the Federation from overseas?
Okay, well, first let me start off by reminding persons that COVID-19 is transmitted mainly by respiratory droplets and also by contact with contaminated surfaces. And as regards to the existence of the virus outside of the human body, we know that it can exist for several days on certain surfaces, hours to days. But in relation to the human body, one doesn't know as yet how long the virus can exist in the dead body. And we advocate using proper protective gear when one is handling the dead body. We also do not advise family members to kiss or touch the dead body as was customary prior to COVID-19. Now, if we are thinking about repatriation of a body, there are 2 cases we have to consider: whether or not the body is cremated or if it is not. If the body is cremated, then it's an easier process in getting that home. In terms of the dead body that is not cremated, airlines themselves, they would request the body to be placed in a specially sealed container. The office of the CMO will obviously have to be contacted so that this body can be safely repatriated. And as a federation, from very early, we put in place protocols and procedures for handling the dead body, and the funeral services here are fully aware of the protocols and procedures for handling the human body. So once the CMO office is contacted, you'll be given the details as to how to get the body repatriated.
Thank you very much, Dr. Wilkinson. I'll turn to the Chief Medical Officer to answer the other questions.
Okay, thank you, Valencia. The first question, what is the procedure when traveling from St. Kitts to the United States? Do we need to take any test? My understanding is that some of the states within the USA require a pre-arrival PCR test, and so some outbound passengers have been requesting the PCR test prior to traveling to the United States. I would like to know when the other hotels will open that are not mentioned. I think most of our local hotels are presently open. The non-branded hotels, they're in the process of developing their protocols such that they can be approved to accept the high-risk tourists. The third question, good night. I'm listening to the new protocols just put in place concerning stepping out of the bubble. I am a citizen in Antigua, wants to come home. My ticket is already booked, but I don't have money to hand to pay for staying at quarantine facilities. Are they going to allow us to pay in installments? And so this is a consideration, and so one can apply for a payment plan. And so if you're a citizen in Antigua wanting to come home, you need to log on to the site, complete the form, upload your bio page, make sure to take the PCR test within 3 days of travel, and make contact with, if you're coming to St. Kitts, the Ocean Terrace Inn or Nevis Pot Works, whereby a payment installment plan can be arranged. The other question, my husband, who is a non-national but a resident of St. Kitts and Nevis, intends to return to the Federation when Canada resumes flights to the Federation. Does he have to request permission to enter the Federation? I am aware of the immigration form that must be filled out online, but what procedures must we follow prior to getting here? So if you are a resident in Canada, thinking about coming home again, you log on to the site, complete the entry form, upload your passport bio page, make arrangement to get your PCR test done within 3 days of travel, and make a booking at one of the COVID-19 certified accommodations we've mentioned tonight, such that you can complete your quarantine. It's recommended that you indicate on the entry form your hotel reservation number or code, and sign the relevant consent forms, and you should be good to go in terms of getting approval to return to the Federation. The last question. Good evening. My question for tonight is, will children under the age of 10 be required to take a COVID test upon entry to St. Kitts? And the answer is yes. Our public health team have been testing children as young as 1 month, 2 months old. And so yes, children are being tested because the science tells us that children have become infected and they can be infective and be a source of spread of the virus also. Thank you.
Thank you very much, Chief Medical Officer. We are pretty much on the dot at 10 o'clock, so I will now invite the panelists to give their closing remarks. I'll turn to Ms. Stewart, who is the Chief Financial Officer and Officer in charge of the St. Christopher Air and Seaports Authority.
Thank you, Valencia. I just want to say that SCASPA remains committed to improving its protocols so as to protect the employees and to ensure the safe processing of passengers through the facilities. As representatives of SCASPA, we want to implore to the general public to take personal responsibility for your health and safety and to follow the recommendations of the medical professionals. Thank you.
Thank you very much, Ms. Stewart. I will now invite Dr. Cameron Wilkinson, the Medical Chief of Staff at JNF, to give his closing remarks.
I just want to remind everyone that we are still in the middle of a pandemic, despite the fact that things might appear near normal within the Federation, that the virus cannot move without our help, and that this virus is always trying to hitch a ride with you to get into your homes, to attack your loved ones, your family, and your friends. And you need to make sure that we continue to keep the virus at bay. As a nation and your government, we have done a significant job in trying to keep you safe. Now that our borders are open, the responsibility is in your hands also. And we've said over and over again that this is one time when the single action of one person can have far-reaching consequences. And so we want you to stay vigilant, don't develop COVID fatigue, and make sure you do the simple things that we have spoken about, and make sure that you always have your mask with you at all times, because this little piece of device can help to protect you and your family. Thank you.
Thank you very much, Dr. Wilkinson. I'll give Dr. Hazel Laws, the Chief Medical Officer, an opportunity to present her closing remarks.
All countries that have reopened their borders have seen a surge in the number of COVID-19 cases. However, this does not have to be our experience. And I'm imploring my fellow countrymen to adhere to the prevention and control measures that we've been promoting over the past few months. Hand hygiene, very, very important. Maintaining adequate physical distance from others when in public spaces. Avoiding crowds. And wearing the face mask. These measures are very, very important in terms of breaking the transmission of this virus and can eventually prevent a surge in the number of cases. So I implore you, wear your face mask, make sure you keep your hands clean, make sure you always have your hand sanitizer with you, maintain physical distance, and avoid crowds now that our borders have been reopened. Thank you.
Thank you very much, Chief Medical Officer. I'll turn to the Honorable Prime Minister to give his closing remarks.
Thank you very much, Val. Before going to my brief closing remarks, I want to reflect a bit and the question with respect to the costs of the quarantine. In relation to anyone who will need a payment plan, we certainly will be accommodating to that request. I should make the further point in relation to the cost of quarantine at government prescribed facilities, in St. Kitts, the OTI facility in particular, that there is no profit made by the government from the payment of fees, quarantine fees. In fact, the government subsidizes the cost of everyone who is quarantined at OTI. Beyond the costs which persons pay, the government pays the full cost, running into thousands of dollars for electricity and water being provided at OTI. The OTI hotel had discontinued its operation as a hotel facility. And so when we took over, or rather, when we rented the facility That was one of the obligations that the government assumed. Additionally, the cost of security being provided at OTI, again, is for the government account. So everyone who stays at OTI receives a subsidized service there. Additionally, the $500, to be exact, is not monies which the government makes any profit on. It is the cost charged by TDC. The TDC group of companies is the owner of the OTI facility, and they charge $500 US. That amounts translate or equates to about $35.60 per day for stay at OTI. I'm advised elsewhere in the region, persons pay between $100 and $150 US to stay in hotel facilities as quarantine. So we are not doing badly. And even at that level of concession, we are still prepared where we can to be of assistance. I shall remind persons that those who have gone abroad or are returning from abroad and had left St. Kitts and Nevis for the purposes of medical treatment, for example, on their return, we are prepared to waive the payment of the quarantine fees and requests. For the students who are returning, we also, on application, will consider waiving the fees. The government certainly cannot be expected, though, to pay quarantine fees for persons who of their own volition left the Federation and are returning. But we do welcome you back. We want you to settle in nicely, but we also want to keep our citizens and residents here safe. And that is why there's the insistence on the quarantine. I think that matter, we need to be advised that the fundamental challenge the government has is how do we keep people safe? How do we contain the virus? How do we prevent the overwhelming of our health facilities? How do we prevent people from dying? And one of the callers drew reference to that. Aren't our people looking at their television set, seeing what is happening in the United States? The most powerful country on earth is having a terrible time managing the pandemic. Just a few days ago, Prime Minister Boris Johnson in the United Kingdom locked down an entire country for a month, from November, I think it is the 5th, onwards into the first week of December. Why was he doing this? Because persons, according to his own national address, had become complacent. They forgot to wear the mask, or they were no longer interested in wearing the mask because they assumed with the diminution in the cases that it was no longer a problem. The truth is the virus is very aggressive, and we are always on the back foot, responding to it rather than being ahead of it. And perhaps we will not get ahead of it until we get a safe and reliable vaccine to protect ourselves. In the meantime, we are left with certain common sense things to do. And we heard our medical experts speak to them. Avoid large crowds. And any of you who have a relative or friend coming in, you should encourage them to undertake the quarantine and to treat it as a serious part of protecting themselves and protecting you from them. It is in our interest that all of us adhere to the requirements. I want, in closing then, to thank all who have called in, the thousands who listen every week to this program across several media platforms. I say thank you. and especially at a very important night in the life of the most powerful country, the United States of America, you have taken the opportunity to participate, and we welcome your participation. St. Kitts and Nevis so far is the model of a best managed small island state. Indeed, our performance in the management of COVID has drawn international attention to the existence of the smallest sovereign country in the Western Hemisphere. We have had international attention because persons marvel, how can we, the smallest of the lot, be doing the best job in the management of a global pandemic? We can continue to lead the world in our careful approach, our stepwise approach to the opening up of our country, taking quick and decisive action when the moment requires it. That is what we have been doing, and that is what we are committed to do. I said to my fellow citizens and residents, we can't go back now. We can't go back to the lockdowns, and we can't go back to the curfews. We can't go back to the queuing up to get into the supermarkets and the alternating of days when we can go into Bastille and visit certain places. We should not want to get back there, and so we must not chance fate. Because if perchance the reckless action of anyone or any group were to lead to a spread of the virus again, we will have to go back from whence we came, and that will be a significant collective failure for our country as a whole. So let us keep safe, let us take the advice given by the health experts in a serious way and do what we must do to protect ourselves, protect our families, protect our communities, and to keep this beautiful federation of St. Kitts and Nevis a lowest destination, the paradise to which others will come to relax and to enjoy not just the charm and beauty of our country, but also to enjoy a refreshing sense of safety and tranquility in our beautiful islands. So may God bless us, and may He continue to keep all of us safe. I thank you.
Thank you very much, Honorable Prime Minister. On a note, it's been an honor and a privilege for me to host installments 9 to 27 of Leadership Matters. This is the 27th edition of Leadership Matters. So I've hosted 19 episodes. Tomorrow I go on vacation, and next month I will be undergoing the entry and quarantine requirements that were addressed tonight. And I feel quite confident to be in exceptionally competent hands. We have been one of the most successful countries in the world in containing the coronavirus, and I would like to take this opportunity to personally thank the Honorable Prime Minister and his administration for his unparalleled leadership, their unparalleled leadership. And I'd also like to personally thank the Chief Medical Officer, the Medical Chief of Staff, and all the members of the Coronavirus Task Force. I also thank the audience for being very gracious and tuning in every week to Leadership Matters. Thank you for watching, especially on this night. Good night. Thank you again for spending another Tuesday night with us.
And thanks to all the panelists who joined tonight.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border